the symptoms that I was having, it was really hard to walk. I've got 5 grandkids. We took them to Disney, and I was the handicap guy trying to keep up and slowing them down.
Mark first came to visit with me last winter, complaining of some chronic pain in his right knee. He had been experiencing it for quite some time. He has a history of multiple surgeries on that knee, including an ACL reconstruction, arthroscopic debridements. His pain had continued to progress to a point where it was starting to interfere with his quality of life. He had been using a variety of different oral medications like anti-inflammatories and Tylenol, using braces, has had injections, and just things weren't really improving.
Urged me to put off the replacement as long as I could. When I met Dr. Boiwka, we talked through that. I like the fact that he was very detail-oriented. After a couple of meetings, we decided that the knee replacement would probably be the best thing for me going forward.
He ended up undergoing a knee replacement. I think within a few months afterwards, he was pretty surprised how well he felt on that leg, to where he started actually picking up on pains elsewhere in the body that were initially masked by that knee. About 6 months later, he was starting to have some significant discomfort on the same hip, to where we actually got some x-rays and investigated that further and found out that he had really advanced arthritis in that hip as well. Undergoing a anterior right hip replacement, again did very, very well. Got back to golfing and all activities very shortly after surgery. A few months later, that pain started creeping up elsewhere that maybe he hadn't noticed as much before. Tried a number of conservative treatments again, anti-inflammatories, injections on his left knee, and ultimately underwent a left knee replacement.
I actually played golf about 8 or 10 weeks after having the knee replacement, even though I probably shouldn't have. There was another golf tournament that sort of a year-long event where you have a partner and we played. And we started that event about 2 weeks before I had my first knee surgery. I was able to play a match, had the knee surgery, played 2 matches between the knee and the hip, had the hip replaced, played a match between that and the second knee, and then we ended up winning that tournament about 8 weeks after I had my 3rd joint replacement, which was pretty cool, that and the hole-in-one.
It's a little unusual to undergo 3 different joint replacements in rather short succession. It is very common to develop significant arthritis after an injury to a joint, including an ACL injury or a meniscus injury. Having multiple surgeries on a joint can also predispose sometimes to development of arthritis.
The ability to do what I want when I want, be active. I'm at the point now where I don't think about the pain, or I don't have the stiffness. I can do things that I haven't done in years, which is fantastic.